You ever been in a game, or even just at practice, when someone just stops? One minute they're giving it their all, and the next they're down. It's a scary moment, right? Well, today, we're building your playbook for exactly those situations. This is about giving you the tools to react with purpose, not panic, when someone's body suddenly slams on the emergency brakes.
So let's set the scene. Imagine it's the final minutes of a huge game, everything's on the line, the energy is insane. Then, bam, out of nowhere, an athlete just collapses. You look over, and they're pale, maybe a little clammy. Something is definitely not right. In that moment of chaos, knowing what to do can be the difference. So let's break down how you can be that difference maker.
Yeah, we're calling these the body's emergency brakes, those sudden, pretty scary moments when the system just seems to shut down. We're going to cover the big five you're most likely to see: fainting, seizures, shock, breathing issues, and diabetic emergencies. And by the end of this, you won't just know what to do, you'll actually understand why you're doing it.
Okay, first up is probably the most common glitch you'll ever run into: fainting. The technical term is syncope, but you can just think of it as the brain hitting a temporary pause button because it's not getting quite enough oxygen.
So what is actually going on here? It's really just simple physiology. For a moment, there's a drop in blood flow to the brain, and boom, lights out. This can happen for a bunch of reasons. Maybe they're dehydrated, it's super hot out, or they just stood up way too fast. You know that head rush feeling? That's actually something called orthostatic hypotension. It's basically your blood pressure taking a hot second to catch up with gravity.
So the warning signs are clues that system is lagging. The person looks like ghost white.
Pale, might start sweating, feel really dizzy, or just say they feel weak right before they potentially go down.
Now, if someone does faint, your game plan is super simple but incredibly effective. First things first, check if they're breathing. Once you know they are, get them lying flat on their back and then lift their legs up about a foot. This one little trick uses gravity to your advantage, helping all that blood flow right back to the brain where it's needed most.
All right, so we're leveling up from a simple glitch to what you could call a full-on brainstorm. A seizure is basically a sudden, uncontrolled electrical surge in the brain. It's like a lightning storm in there, and it causes the body to act completely involuntarily.
And the causes aren't just epilepsy, right? The sources mention other triggers.
That's correct. Epilepsy is a common cause, of course. But seizures can also be triggered by things like infections, a head injury, or even a really high fever. Especially in young kids, those are febrile seizures.
And you gotta forget what you've seen in the movies, because seizures aren't always some big, dramatic event. Sometimes it's an absence seizure, where a person just kinda zones out. They'll have a blank stare, totally unresponsive for a few seconds. It might look like they're just daydreaming, but trust me, they're not there. And then you have the grand mal seizure. That's the one we all picture, with the intense, full-body convulsions.
Let it run its course.
So what do you do then?
Focus on safety around them. Move hard or sharp objects away. If you can, slide something soft under their head like a jacket. Then, once the convulsions stop, check their breathing. If they're breathing normally, carefully roll them onto their side into the recovery position. The only exception is if you suspect a head, neck, or spine injury, then you'd leave them flat, very still, until help arrives.
Got it. Protect, don't interfere during, recovery position after.
Okay, listen up, because this is probably one of the most important things you need to remember. When someone is having that big convulsive seizure, there are two absolute non-negotiable nevers. One, you never ever try to hold them down or restrain them. You literally can't stop the seizure, but you can very easily injure them. Two, never put anything in their mouth. That old story about people swallowing their tongue, it's a total myth. You're way more likely to break their teeth or get your own fingers bitten.
When do we call 911 for a seizure?
Good question. Call 911 if the seizure lasts longer than 5 minutes, or if they have another seizure soon after the first. Also call if the person is injured during the seizure, if they're pregnant, known to be diabetic, or if this is their very first seizure. Basically, when in doubt, call.
All right, let's do a quick brain break. We literally just went over it, but it's so important I want to hit it again. What's that one thing you are absolutely positively never supposed to do during a big convulsive seizure? Think about it for a second.
If you said don't restrain them, you are 100% correct. Your job isn't to be a hero and physically stop the seizure. Your job is to be a safety coordinator. Clear the area, move chairs, water bottles, anything they could hit out of the way. If you can, slide a jacket or something soft under their head. Just let the seizure run its course and keep the space around them safe.
We're shifting gears again, and this time we're moving into a true, life-threatening medical emergency, physiologic shock. And no, this isn't about being surprised or scared. This is a critical system failure, where the body's most important organs are literally being starved of oxygen-rich blood.
If you remember only one single thing about shock, make it this: the skin. Check their skin. If it's pale, cool to the touch, and kind of clammy or moist, that's your sign. Why? Because the body has gone into full-on survival mode. It's pulling blood away from the surface, the skin, to try and protect the vital organs like the heart and brain. It is a massive, flashing red flag.
So if you see those signs, your very first move, no hesitation, is to call 911. Every single second counts. While you're waiting for help to arrive, have the person lie down. If there's any serious bleeding, control it with pressure. And, this is important, cover them with a blanket or jacket. They might say they feel hot, but their body is losing core heat fast, and that's dangerous.
And here is another huge critical don't for when someone is in shock. Do not, I repeat, do not give them anything to eat or drink. Their digestive system is basically shutting down to conserve energy, and anything you give them could make them choke or vomit. Okay, let's talk about two more critical alerts that you are pretty likely to run into, especially in a sports setting: a life-threatening allergic reaction and a diabetic emergency.
Let's start with breathing.
Right. Breathing emergencies can pop up for various reasons: choking, maybe trauma, severe allergic reactions, or chronic conditions flaring up, like asthma.
People with asthma may have difficulty breathing when they are exposed to certain substances or conditions called triggers. Common triggers include exercise, temperature extremes, air pollution, strong odors, allergies, respiratory infections, and stress. Exposure to the trigger causes the airways to swell and become narrower, making it harder for air to move in and out of the lungs. Signs and symptoms of an asthma attack are similar to those of any other breathing emergency and include wheezing or coughing, rapid shallow breathing or trouble breathing, being unable to talk without stopping for a breath in between every few words, anxiety and fear, sweating. A person with asthma can minimize the frequency of asthma attacks by avoiding triggers and taking prescribed long-term control medications. But when an attack occurs, prompt action is needed to open the airways and restore normal breathing. The person will most likely have a prescribed quick relief or rescue medication to use in the event of an asthma attack. Encourage the person to use his or her quick relief medication as directed by his or her healthcare provider, assisting if needed and state or local regulations allow. Call 911 or the designated emergency number if the person's breathing does not improve within 5 to 15 minutes after taking the medication, or if the person becomes unresponsive. Monitor the person's condition until the person is able to breathe normally or until help arrives. Anaphylaxis is a severe allergic reaction that can develop within seconds or minutes of being exposed to an allergy trigger or allergen. A person who is experiencing anaphylaxis may have trouble breathing and go into shock. Because anaphylaxis is life-threatening, it is critical to act quickly to stop or slow its effects. To recognize anaphylaxis, look at the situation and the person's signs and symptoms. If you know that the person has been exposed to an allergen, look for trouble breathing or signs and symptoms of shock. Remember that signs and symptoms of shock may include excessive thirst, pale, cool, moist skin, changes in level of consciousness, and a rapid, weak heartbeat. A known exposure plus trouble breathing or signs and symptoms of shock equals anaphylaxis. If you think the person may have been exposed to an allergen, look for any two of the following signs and symptoms. Any skin reaction, such as hives, itchiness, or swelling. Swelling of the face, neck, tongue, or lips. Trouble breathing. Signs and symptoms of shock. Nausea, vomiting, cramping, or diarrhea. Any two of these signs and symptoms, in combination with suspected exposure to an allergen, equals anaphylaxis. If you do not know whether the person has been exposed to an allergen, look for any skin reaction or swelling of the face, neck, tongue, or lips. If the person has a skin reaction or swelling, and the person is having trouble breathing or showing signs and symptoms of shock, then assume anaphylaxis. When you recognize that a person is experiencing anaphylaxis, have someone call 911 or the designated emergency number immediately. If the person has a prescribed epinephrine auto-injector or an auto-injector is available and you are authorized to use it, help the person use the auto-injector. When administering an epinephrine auto-injector, be sure to hold the leg firmly during the injection to limit movement of the person's leg. Remember that anaphylaxis is a care-first situation, so if you are alone, help the person first and then call 911 or the designated emergency number. While you wait for help to arrive, make sure the person is sitting in a comfortable position, or have the person lie down if he or she is showing signs of shock. Provide reassurance. If the person is still having signs and symptoms 5 to 10 minutes after the first dose, and emergency responders have not arrived, help the person administer a second dose if another auto-injector is available.
Asthma seems common, especially with exercise-induced asthma. What's the first aid there?
So asthma involves the airway swelling and narrowing, making it hard to breathe. If someone is having an asthma attack and asks for help with their inhaler, their quick relief medication, your role is mainly to assist them if they need it. Help them shake the inhaler, remove the cap, make sure they're using it correctly as prescribed.
And how quickly should it work?
You should see some improvement, ideally, within about 5 to 15 minutes. They might need more than one puff, depending on their action plan, but if their breathing doesn't improve after using the inhaler, or if it gets worse, or if they don't have their inhaler, that's when you call 911.
Anaphylaxis, that's the technical term for a severe allergic reaction, can close someone's airway in minutes. The game changer here is an EpiPen. The drill is call 911, then take the EpiPen to the outer middle of the thigh. Push it firmly until you hear a click, hold it there for about 10 seconds, pull it out, and then massage the area. Do not hesitate. Speed is everything here.
Now, diabetic emergencies are all about a balancing act gone wrong. You've got high blood sugar or hyperglycemia, which is kind of like a slow burn. It develops over time. But then you have low blood sugar, hypoglycemia, and that's a sudden crash. That's the one you're most likely going to see on the field, usually from an athlete who skipped a meal or just pushed themselves way too hard. The signs hit fast and hard: shakiness, sweating, confusion, dizziness.
So if you suspect someone has low blood sugar, and this is key, they're awake and can swallow, you need to get them sugar, and fast. We're talking about 15 to 20 grams. That's like half a can of regular soda, a few glucose tablets, or even a tablespoon of honey. Give them the sugar, and if they don't start to improve in about 15 minutes, or if they become unresponsive, that's when you call 911.
So, we have covered a lot of ground. But here's the main takeaway I want you to have. Understanding why these things are happening is the secret sauce that turns panic into purposeful, calm action. Knowing why you lift the legs when someone faints, or why someone in shock gets clammy skin, that's what gives you the confidence to step in and do the right thing.
Think of it this way. You now have a mental first aid kit. It's way more than just knowing to call 911. It's about being able to read the signs the body is sending you, to see the pattern. And that knowledge, that ability to recognize what's going on, empowers you to make a huge difference when it counts the most.
So I want to leave you with a challenge. What's one small thing you can do today to be more prepared for tomorrow? Maybe it's just asking a teammate where they keep their EpiPen. Or maybe it's finding the first aid kit in the gym so you know where it is. What is one tiny step you can take to be the person who knows what to do in a crisis? You've got the knowledge now. Go be ready.